All right, so COVID cases are on the rise again, but that's far from the only illness spreading right now.
Yeah, with the kids back in school, the germs are spreading fast and furious, and you know, they're bringing those germs back home to you. So Dr. Frank McGeorge joins us now to kind of break down exactly what's going around. I've got a few mom friends that are sick thanks to the kiddos, so.
It's out there,
yeah,
Karen
it's out there.
What are you going to say? You know, doctors often refer to it as back-to-school plague. Some schools have been in session for a couple of weeks already, and that has been enough to spike the number of contagious illnesses that we're seeing. Here's what's going around where you live.
In Wayne County, Dr. Tiffany Widener at Children's Hospital is seeing more kids with COVID, a lot of viral upper respiratory infections, and some hand, foot, and mouth disease. Dr. Jamie Hope at the Beaumont Outpatient Campus in Livonia also reports an uptick in back-to-school viruses, including COVID. The CVS Minute Clinics say pink eye is on the rise. They're also treating strep throat and seasonal allergies. Over at Oakland County, Dr. Justin Skrzinski at Corewell Health Beaumont Royal Oak is seeing more COVID cases and the typical viruses causing head colds and sinus infections. The ER at Henry Ford West Bloomfield reports more shortness of breath this week, and the CVS Minute Clinics note pneumonia is on the rise. They're treating a number of ear infections as well. West to Washtenaw County, ER Dr. Brad Uran at Michigan Medicine reports a notable bump in COVID cases. He's also seeing some upper respiratory infections and stomach viruses. Checking out Monroe County, ProMedica Monroe Regional reports patients with stomach virus symptoms and headaches. Doctors' offices are seeing more COVID and upper respiratory infections in general. Moving to Macomb County, ER Dr. Anna Rivers at McLaren Macomb reports an increase in upper respiratory infections as kids return to school. Their volume of COVID cases has remained steady with mostly mild symptoms. Dr. Marissa Samuel at Henry Ford Sterling Heights is treating flare-ups of asthma and COPD, and the CVS Minute Clinics report sinus infections, swimmer's ear, and bug bites and stings. Finally, in Livingston County, Trinity Health Livingston and the Brighton Medical Center have both seen an increase in COVID, strep throat, and coughs and colds. Doctors also report a few bat exposures.
Now, if you have school-age kids, be sure to remind them to wash their hands frequently at school, cover their coughs and sneezes, and avoid sharing foods or drinks or items like towels or chapstick. Keeping sick kids at home, can also help reduce the spread of viruses in school.
Keeping your kids away from your chapstick is hard. I'll tell you that. They always use it in my car.
I wouldn't share it with their friends, though.
Oh, okay, you know? Because they're always doing that. Okay, so what are the guidelines in terms of, why we should keep the kids home? What do we have to keep track of?
Well, so every specific school district does have their own set of rules, but in general, kids should stay home if they have a fever, if they have any vomiting or diarrhea, a bad cough, fatigue, or any breathing issues. And obviously, if they have COVID or the flu, they need to stay home. Now, with most viruses, we are most contagious and feel the worst at the very beginning of the illness. So giving kids that time at home, it's not only going to help them recover more quickly, it really does make a difference in reducing the spread of viruses to others.
That time of year.
Sure is.
Thank you, Doc.
Thanks.